A group of glaucomas characterized by elevated intraocular pressure, as a result of mechanical obstruction of the trabecular meshwork, by either apposition of the peripheral iris to the trabecular meshwork or by synechial angle closure. Symptoms: pain, periocular, headache, abdominal, blurred vision, photophobia, colored halos around lights, nausea, vomiting, red eye. Signs: closed angle in the involved eye, narrow or concludable angle in the fellow eye of primary etiology. Glaukomflecken. Conjunctival injection, fixed, mid-dilated pupil, bilateral shallow anterior chamber, acutely raised IOP, usually 50 to 80 mm Hg, microcystic corneal edema. Epidemiological. Age greater than 40 years old. Mean age of diagnosis is around 60 years. Male sex. Ethnicity Chinese, Southeast Asians. Anatomical. Pupil block mechanism. Narrow angle, shallow anterior chamber, relatively anterior iris lens diaphragm, large lens, older, cataract, small corneal diameter, short axial length, usually hypermetropic. Risk increases with increasing lens thickness to axial length ratio. Plateau iris mechanism. Plateau iris configuration, relatively anterior ciliary body that opposes the peripheral iris to the trabeculum. Anterior chamber depth normal centrally, shallow peripherally with flat iris plane. Causes: etiology of primary angle closure, pupillary block, apposition of the lens and the posterior iris at the pupil leads to blockage of aqueous humor flow from the posterior chamber to the anterior chamber. Angle crowding as a result of an abnormal iris configuration including high peripheral iris roll or plateau iris syndrome. Angle closure. Investigations. Slit lamp examination, both central and peripheral anterior chamber depth, ACD, may be assessed at the slit lamp. The Van Herrick technique, measure intraocular pressure, IOP, gonioscopy of both anterior chamber angles. Medical treatment, topical therapy with beta blocker, topical pilocarpine, 2% or 4%, can also be used. Intravenous/oral acetazolamide 5 to 10 mg per kilogram, topical steroid. Compression gonioscopy is essential to determine if the trabecular blockage is reversible and may break an acute attack. Mydriatic and acycloplegic agent cyclopentolate 1% to 2%, and phenylephrine 2.5% every 15 minutes for 4 doses. Systemic steroids may be required to treat serous choroidal detachment secondary to inflammation. ND-YAG peripheral iridotomy, iris procedures, surgical iridectomy, angle procedures, goniotomy, trabeculotomy, trabeculectomy with / without augmentation. Deep sclerectomy, minimally invasive glaucoma surgery, MIGS, and Seton's, tube drainage surgery. Thank you.